So, if you're one of the millions of people living with chronic joint pain, you know the drill, right? The frustration, the treatments that promise relief but just don't quite deliver. Well, what if the way we've been fighting this pain has been aimed at the wrong target all along? Okay, let's dive into a really groundbreaking approach that is completely changing the game. To really get the scale of this, you just need to know one number. 1 in 3. Yep, that's roughly how many people in the United States are affected by chronic pain. It is a massive, massive public health issue, and, with an aging population, it's only getting bigger.
The standard playbook for joint pain is pretty familiar to a lot of folks. You start with painkillers, which, let's be honest, can have some nasty side effects. Then you move on to injections, but those often become less effective over time. And then, what's the final option? Usually, it's major surgery, like a knee replacement, which a lot of people just aren't ready for. There's this huge gap for patients with mild to moderate disease who are kind of stuck in the middle.
This is where the story takes a really fascinating turn. This whole new approach comes from asking a simple but honestly a profound question. Instead of just masking the symptoms of pain, what if we could go after the biological engine that's actually creating it in the first place?
To do that, first we have to understand what's really going on deep inside an aching joint, because it's not just simple wear and tear, it's an active biological process that's running wild. The main culprit here is something called chronic inflammation. The best way to think of it is like a fire alarm that's just stuck on. The body's healing response gets switched on, and then it never switches off. It creates this constant state of alert that, instead of healing, actually causes more damage and more pain over time. So, what does this out-of-control inflammation do? Well, it starts sending out signals that trigger the growth of new blood vessels. But these aren't healthy, normal vessels, no way. They're abnormal, they're tangled, and they create this state that scientists call hypervascularity. It's like a chaotic mess of new plumbing where it shouldn't be.
And this is where you get this vicious, self-feeding cycle. The inflammation leads to these tangled new blood vessels. But get this, growing right alongside them are tiny, new, extra-sensitive nerve fibers. These are the nerves sending those constant, nagging pain signals back to your brain. And those pain signals, they just tell the body there's still a problem, which, you guessed it, just fuels more inflammation. The cycle just repeats, getting worse and worse.
So if that cycle is the problem, how do you break it? Well, not with a scalpel, but with a technique that's just so elegant, precise, and minimally invasive. The solution is called Transarterial Embolization, or TAE. And the concept is incredibly clever. An interventional radiologist goes in through an artery and delivers these microscopic particles directly to those abnormal blood vessels we were just talking about. Those little particles then create a tiny roadblock, basically cutting off the blood supply that's feeding that whole cycle of inflammation and pain. Now, the most common place this is being used is for osteoarthritis of the knee. And when it's performed there, it has its own specific name, Genicular Artery Embolization, or GAE. The arteries you see right here, the genicular arteries, those are the ones that supply the knee joint, and they're the ones that go into overdrive in people with chronic knee pain.
So how does it actually work? Well, it's pretty straightforward, really. First, using ultrasound, a tiny, flexible tube, a microcatheter, is inserted into an artery, usually up in the thigh. Then it's expertly navigated through your body's highways until it reaches those specific arteries feeding the inflammation in the knee. Then microscopic particles are released, and finally, those particles just block the abnormal vessels. And that's it. The cycle is broken.
And the results, look at this. They are visually stunning. On the left, you see an image from before the procedure. See that dense, kind of blush-like area of tangled vessels? That's the problem. That's the engine of the pain. Now look at the right. That's the aftershot. The abnormal vessels are just gone. Doctors call this a pruning effect. It's not about cutting off all blood flow, not at all, but selectively removing the bad branches to bring the joint back to a normal, healthy state. Okay, the images look great, but the most important question, right, is, does it actually relieve pain for patients? So let's take a look at the evidence.
This number is incredible. It comes from a landmark study that followed patients for 2 whole years after they had the GAE procedure. A 79% reduction in pain and stiffness, that is a life-changing result. And the fact that it holds up for 2 years shows this isn't just some temporary fix.
Visually, the data is just as dramatic. Study after study shows the exact same pattern. You look at scales where patients rate their own pain. The before scores are always consistently high, and the after scores just plummet. And they see those huge improvements usually within the first 1 to 4 months.
And to prove this isn't just a placebo effect, the procedure has been put to the ultimate test, the gold standard of medical research, the randomized controlled trial. They've compared GAE against a sham or a fake procedure and found that the real deal is significantly more effective at reducing pain.
Now here's what's so exciting. The knee was just the beginning. Researchers realized that the same mechanism, inflammation driving this abnormal vessel and nerve growth, is at play in other joints too. So this technique is now being applied to treat chronic shoulder pain, including that notoriously difficult to treat frozen shoulder.
And the list just keeps growing. Early studies are showing really promising results for tennis elbow, for hip osteoarthritis, and even for one of the most common causes of heel pain, plantar fasciitis. This is basically a platform technology that could be adapted for chronic pain all over the body.
So what does this all mean? What's the takeaway here? Well, we're looking at what could be a fundamental shift in how we approach chronic musculoskeletal pain. So the bottom line is this. We've learned that chronic joint pain isn't just a mechanical problem, it's a biological one, driven by that cycle of inflammation and vessel growth. Embolization directly and safely targets that root cause. And maybe most importantly, it offers a powerful new path for people who have failed other treatments but just aren't candidates for a big surgery.
Look, this isn't about replacing every other treatment out there. It's about adding a vital new tool to the toolkit, one that's minimally invasive, super targeted, and offers the potential for real, long-lasting relief. For millions, that represents a new kind of hope.
It really makes you wonder, doesn't it? We often think of medical breakthroughs as these complex surgeries or powerful new drugs. But maybe, just maybe, for one of our most common ailments, the answer is something much smaller, much more precise. A future with less chronic pain, potentially unlocked by a single tiny particle.